We've worked a lot on recessive genetic diseases. So recessive genetic diseases are ones where the parents are carriers of the disease, so they're not affected. But then they have, with every child that they have, a 1 in 4 chance of having a child with that severe genetic disease. And so for decades, I'd wanted to be able to find those couples who have a high chance of having a child with severe genetic disease and allow them to know beforehand that they had this high chance. Started thinking about this in the late 1980s, but then there wasn't a technology where you could screen the population to find these carriers. But with the Human Genome Project inventing new methods of DNA sequencing, it became possible to do this. And then along came Rachel and Jonathan Casella, whose daughter Mackenzie died from spinal muscular atrophy at 7 months of age. And Rachel and Johnny lobbied every single member of federal parliament to do something about carrier screening and making it available to Australians. And out of that came Mackenzie's mission, named after their daughter. And Mackenzie's mission was a $20 million research project. Mackenzie's mission can detect 5 times as many high-risk couples as 3-disease screen. We screened over 9,000 couples, and we showed that just under 1 in 50 couples that participated had the high chance of having a child with severe recessive genetic disease. And we published this in the New England Journal of Medicine in November 2024. And it made a bit of a splash in human genetics around the world. And so now the task is to work with the state and federal health departments to make this carrier screening available to any Australian that wants to use it.